Welcome to the Political Philosophy Podcast. I'm Toby Buckle. My guest today is Yolonda Wilson, who is an Associate Professor in Healthcare Ethics at St. Louis University. She's, like a lot of my recent guests actually, she's someone who I've been like social media friends with for some time now, back to when I started up on Twitter, in fact. So it was a real pleasure to get her on the podcast. This is a fairly wide-ranging general conversation. We cover what bioethics is. We look particularly at some issues in the field, focusing on why there are differential healthcare outcomes between black and white Americans, sort of what goes into that and how we might think about it. And we also discuss what I call in my head social justice concept creep, which is like how terms that originated in academia, like structural racism, for instance, can then get picked up and used and misused in our sort of broader political conversations, sort of what that looks like and what some of the potential concerns about how that goes are. So I thought this was a really interesting conversation. I hope you do too. As always, if you like the show, please do consider supporting me on Patreon, patreon.com/political philosophy podcast, patreon.com/political philosophy podcast. I don't do any advertisements on the show, and almost all of the episodes go out for free. All of that's made possible by voluntary support of listeners. And I'll also add that in an age of a radicalizing and increasingly dangerous right, I think a lot of media and political commentary has not really met the moment, and we need to stop supporting media that isn't and support people who are doing their best to make sense of and oppose what's happening. So please do support if you can. Thank you so much to everyone who already does. And if you're not able to support financially, sharing episodes on your social media also really helps. So thanks for that as well. Okay, let's get straight to this week's episode. This is Race and Bioethics with Yolonda Wilson. I am joined today by Professor Yolonda Wilson. Thanks so much for coming on the podcast.
Thank you so much for having me. I really appreciate being here and getting the chance to chat with you.
Yeah, absolutely. Let's start with your core area. You are described as a bioethicist, which is actually a slightly weird word to say, ethicist. You was described as a bioethicist. For people who have not come across that term before, what does that mean, and what sorts of issues do you work on in your academic work?
Okay, so bioethics is actually a broad term and you see my little poster in the background. Bioethics is actually a really broad term that can encompass anything from kind of ethical issues that arise directly in healthcare, including clinical ethics or thinking about what happens with patients, for instance, at the end of life, or how to make decisions about care. It can encompass things like biotechnology and gene editing. It can encompass research ethics. It can encompass kind of legal questions arising in kind of healthcare arena or theological questions. I'm at a Jesuit institution, and so there are a lot of my colleagues who are really interested in what kind of theological commitments and how to reconcile one's theological commitments with some healthcare interventions. So we're really broad, and you see people, you see philosophers, you see lawyers, you see social workers, nurses, people in public health come uh, into our field, and so we're a broadly interdisciplinary field. I am a philosopher by training, and so I come to bioethics through philosophy. And actually, my background is in social and political philosophy. And so, not really the kind of bioethics aspect of philosophy, but really thinking about political structures, thinking about social structures. And for me, as I found myself really interested in those things, I also started thinking about what the consequences are for our health and well-being.
Health is your focus, particularly I've seen some of your talks now as it relates to like inequalities of care, right? Like different outcomes you might get for men versus women, black people versus white people, those sorts of questions, right?
Yeah, yeah. So, uh, one of the principles of bioethics is justice, right? And so, given that I'm a political philosopher, I think a lot of the work that I do situates in thinking about that principle. Among the other principles of bioethics include beneficence, right? Doing good things for patients or for research subjects. Non-maleficence, so not causing harm, and autonomy, kind of respecting people's right to make certain kinds of decisions that determine their lives, right? But I think justice ends up being my primary focus coming in as a political philosopher. And yeah, so I do think about not just what are the consequences of, for example, health disparities or political choices that we make in the society around access to healthcare and distributing the good of healthcare, for example, but also I think about it as, if we're bioethicists and we're committed to the principle of justice, we're committed to just social structures, we're committed to just outcomes, we're like however a bioethicist conceives of what it means to be committed to justice, then we have to think about the ways that our society is structured that reinforces a kind of injustice for patients, for people broadly across the lifespan.
I want to come back to that phrase, how society is structured. Um, could you maybe, before we even get to that, give some concrete examples of how society-wide injustices might show up in the type of healthcare people receive or the type of health decisions they make, just so people can have a reference point for what we're talking about?
Right. So it's funny. I'm in a seminar now with one of my physician colleagues. And so yesterday, a lot of the conversation was around how insurance reimbursements are structured, how Medicare and Medicaid are structured. And so, some of the means testing that happens around Medicare and Medicaid, right? Making sure that one is of a certain age or thinking about whether one has the right kind of disability in order to be eligible for certain kinds of subsidized healthcare. I know that you have an international audience, and so I'm sure that it's always quite befuddling to think about how US healthcare is structured.
We're mostly America. It's like
Yeah.
55 America
Okay.
percent, then a good chunk UK, and then kind of everywhere. But yes, for non-Americans, our healthcare system is indeed it's a lot to get your head around sometimes.
It is even people who work directly in the healthcare systems, right? Like physicians are often just confused by, what the requirements
So
are
this is
and what
something like
reimbursements
I
are.
try to explain is I think a lot of people have it in their heads that like America is like just god awful. It's like the Soviet Union healthcare, and it's not quite that. Like in the British NHS is really struggling right now. A lot of European systems are. But the thing with the American is just how complex it is and how much mental labor. I think that side of things is really hard to understate for a foreign audience. I'm drawing this down another path, but anyway.
Yeah, no, that's fine, but that's actually relevant, right? I mean, some of the ways that those complexities are baked into US healthcare also result in people who need care not getting care, right? We know that generally. But some of the ways that healthcare in the US is structured falls in alignment with kind of historical um, oppression and lack of access and disadvantage. So, for instance, you'll find regulations around where hospitals can be built and what hospitals must include. And so, what you find in poorer zip codes, which are disproportionately zip codes where people who are Black and Latino live and have historically lived are often places where there's not the same kind of access to care. There may not be a hospital at all. Rural areas in the U.S. have a similar thing happening where hospitals just don't exist, right? That's baked into how we structure part of how we structure U.S. healthcare. It goes to the complex reimbursement schemes and all of that, right? Adding to that complexity is the ways that some of the subsidized healthcare works in that physicians and other kinds of providers, maybe physician assistants or nurse practitioners, so mid-level providers, are often not compensated at the same rate with, say, Medicaid, which is the public government subsidized insurance that people below the poverty level may have access to. And so it disincentivizes physicians and other kinds of providers from providing care in neighborhoods where you have large populations of people who are on Medicaid. And due to kind of historic disadvantage that is continuing, a lot of those communities are communities that are largely people of color. And so that's just one example. Again, people who have some familiarity with U.S. healthcare, that may make sense. For people who don't, that may be still a little difficult to wrap their heads around. So we can talk more about that as we go on if we come back to that conversation.
So, does the story you've just told, is that the causal explanation or one of the causal explanations for why, say, you might see a life expectancy gap between black and white Americans, or more or less affluent white Americans, or gaps between different regions and so on?
It certainly plays a role, certainly plays a factor. And, some of that is also what happens once one navigates the healthcare, right? So there's, I want to say he's a sociologist of health, but I may have that wrong. David Williams talks about how, um, even when you control for kind of wealth and insurance status, Black patients still have these worse health outcomes. And I think the numbers that he ran, according to the numbers that he ran, Black women with college degrees have worse health outcomes along several metrics, maternal fetal health, for example, than white women who don't have high school diplomas, right? So, whereas you can say, I think accurately, that poor white people have worse outcomes than white people in the US who have more money and resources. It's also the case that it's not just a simple story of having more access to money and resources and insurance, because you still see the lag in African American populations, for example,
So, in
even
other words, just to put it in my own terms so I know I've understood what you've said, it's like if you made a statistical model and held even a number of variables and income, region, whatever, you would still see an effect for race, even after controlling for the sort of more, well, race is, even for controlling for the sort of more monetary stuff, it would
yes,
still be a white person and a black person who, earned the same, went to the same schools, all of that, you'd still see differential impact,
yes.
differential outcomes.
Yes, yeah, yeah. And some of that is, again, once you resolve the access question, what happens when you go to the doctor, right?
Mm.
Or your nurse practitioner or whoever your provider is? How are you treated? How are your symptoms regarded? And, what is happening in your life and in your world before you even get to the doctor? So there's some work around the stress of, say, racism or sexism has effect on the body in that shows up, right? In, for example, an obvious kind of case is high blood pressure that there seemed right. I mean, we know generally that stress and right there's a connection between the amount of kind of life stress and life stressors that one has and high blood pressure. It's not exact, right? There are people who live very stressful lives who have fine blood pressure, so I'm not making that claim. But
Mm.
we do know, right, that one of the ways it kind of non-medicine of controlling blood pressures, you have all these kind of wellness courses and you think about kind of mindfulness and deep breathing and trying to manage one's stress level. But what we find is in so-called marginalized populations, the stress of, or at least one hypothesis is that the stress of dealing with racism or sexism or homophobia in your kind of day-to-day life accumulates over time, and that has some impact on blood pressure.
Intuitively, it makes sense. I mean, this is as far from anything I know about as anything I know about, but
Yeah,
like
yeah.
the idea that at high stress, it impacts your physical health just anecdotally feels true to me. The times in my life when I'm at very high stress, like you just seem more susceptible to colds and illnesses and stuff. So, not. I'm as far away from a doctor as you're going to get. That doesn't feel like a wild thought to me, that like persistent discrimination might have physical health impacts.
Not wild to you, wild to some. There's some who would resist that narrative. I won't name any names, but I can imagine that there, I don't even have to imagine that there are people who would resist that kind of narrative.
Well, I mean, when it comes to differential impacts, be it, race, gender, whatever, the sort of standard conservative talking point would be something to the effect of the fact that there's a difference doesn't mean discrimination is the
Right.
cause of that difference. And when
Mhm.
it comes to like scores or something, what they seem to be imagining is, to be blunt about it, just that black people are dumber, right? That's what they
Mhm.
seem to be thinking and
Mhm.
explicitly are saying in some cases.
Mhm.
With health, do they just seem to imagine that what's the counter argument that certain people just sort of have higher blood pressure? That's
Yeah, I mean, if you're going to make a kind of eugenicist claim, right, that certain bodies are just inferior, right? And so, of course, you
that's what people push back against that
yeah,
narrative
right.
with.
Yeah, yeah. And so, of course, you're going to see these kinds of health issues in people who are genetically inferior. Or you might hear kind of it all being chalked up to kind of lifestyle and conscious choices, right? Well, these
Hmm.
people just don't exercise or just don't take care of themselves, or, this is where the kind of personal responsibility narrative comes into play. And I just reject that altogether, at least in the way that it plays out in the US, because, we significantly underfund meaningful healthcare. I mean, it is true that we spend more on healthcare than a lot of other countries, but in kind of meaningful ways and meaningful interventions, we don't do a lot of that, and we don't ensure that people have access to things that they need in order to live the best lives that they can live. And so certain decisions aren't just kind of individual decisions about one's health or individual decisions not to care about one's health in their relevant ways. But yeah, so those are two kinds of arguments that you see conservatives make, kind of eugenicist arguments and also personal responsibility arguments.
You don't give any weight at all to I don't know, to just give you a counter case. Like surely, like if I choose to smoke or not, right? That is a personal choice that would have a reasonably big health impact. So it presumably has some role, right?
Oh yeah, yeah, absolutely. I'm not saying there's no role at all.
Mm.
But I also like to think about the context in which things happen, right? I mean, there's a reason why you don't see cigarette commercials on TV in the way
Right.
that you did 20, 30 years ago. There's a reason why even on films and television series, smoking is a warning, just like nudity and sexual content, at least on
Mm.
American television. Right? I mean, but you don't see that across the board. So there are communities in where, cigarette usage and cigarette advertisements are still quite predominant. And so even the choices that we often think are completely autonomous choices aren't. And so again, I'm not suggesting that um, people don't know that there's a link between smoking and other kinds of health outcomes. I'm just suggesting that often, not always, whether one smokes or how much one smokes, that decision doesn't happen in a vacuum.
When you pull together that total sum of causes that we've just admittedly roughly sketched over, you've got the incredible complexity of the UF system, you've got differential access, you've got differences in how care is provided, you've got differences in, like, as you say, the types of information people might be getting and so on. This is where someone, and I couldn't help but notice, used the term structural. This is where someone would start employing like a concept like structural racism. Do you think that fits there for that whole concept, for that whole package of things?
I do think that there is a structural oh, excuse me, there is a version of a kind of structural story that has explanatory power. I absolutely think that, even as I've been kind of critical of some structural narratives, I think sometimes um, we think about we get so focused on the structures that maybe individuals don't feel that they have responsibility to act. But yeah, I mean, one
Give me both sides of that then. Like,
okay.
what's like the good version of structural racism, and then what are some of your concerns with how it is sometimes used?
The good version of structural racism.
You know what I mean? You know what I mean?
Yeah, yeah. So to think about kind of structural racism or structural injustice broadly, of which structural racism is a variety, right? There you're thinking about the kinds of social arrangements and institutions that disadvantage some, and it's iterative, right? It happens over years or over a period of over generations. And that these arrangements affect people because of their membership in some social group, whether it's kind of favored member where one is advantaged by virtue of their membership, or disfavored membership where one is disadvantaged by virtue of their membership in an identifiable social group. And so that's kind of the broad picture of kind of social justice or social injustice, and or sorry, structural justice or structural injustice. And so structural racism would be kind of that distilled using race as the identifiable social group that one is thinking about. So the kinds of social arrangements, political arrangements, governmental structures that favor or disfavor some by virtue of their membership in a racial group. And so, if you see, it doesn't require, in some sense, it doesn't require kind of goodwill or ill will or an individual actor. And I think there's a time where, and I think sometimes we still see this, where people are very preoccupied and very obsessed with whether they are personally being called racist. That kind of derails conversation, I think. But the idea of social structures, right, of structural racism is that there's a way in which and those of us who have been in any kind of institution know that there's a kind of inertia around institutions. So once kind of policies and practices are established, it becomes very difficult to change them, even if one wants to. And they seem to kind of move and function on their own, or at least that's how it feels a lot of times. My criticism there is, I think sometimes we use the kind of bigness and slowness of structural change as an excuse not to do anything, right? That, oh, well, since I am personally not responsible for X, right, or I'm just a cog in this larger system, there's nothing I can do. And I think sometimes the discussion of structural racism or structural injustice can obfuscate the reality that actually people do comprise institutions and systems. And, at lots of inflection points, there are people making decisions about whether to go left or go right, or go, up or go down. And so it's not that, so while there is some sense in which kind of institutions churn along, there are also very real ways that people can intervene in what happens in those institutions. And I think we can see that in broadly the US now, right? There's this sense that the institutions of our political system, for example, are self-sustaining in such a way that there are guardrails to protect against too radical a change in one direction or another, or change in ways that violates the social and political
Yeah.
norms of the political system. And what we see happening in real time is that there are individuals who are flouting those norms and those structures and kind of institutional practices, and other individuals who at least some perceive aren't doing enough to kind of protect those guardrails. And so, you know, I don't want to feel like, we're getting too far afield, but I think for good or for bad, we're seeing an example of well-established political institutions changing in real time, right? So there is the possibility of change now. Whether that's the kind of change you want is another discussion, but we are seeing the ways that individuals can put pressure at, on the inflection points. And so this idea that we just all must throw our hands up and be powerful to the institution, again, we're seeing in real time that that's not the case. And
Yeah,
so if we had the desire to operate in the other direction, right, to ameliorate structural racism or structural injustice broadly, I'm not saying to kind of violate the guardrails or flout norms, but there are ways we're seeing in real time that can happen, that rapid change can happen, actually.
I think I'm coming from a very similar perspective, albeit, more on the sort of. But no, no. I mean, what you said is about how these ideas are being used and understood and interpreted. Like, because of the sort of imports from academia that got out into the world, structural racism or structural injustice, more broadly, perhaps, is definitely one of them. That's one people picked up and used. I think, on the one hand, if you get an instance in an institution, like a workplace or whatever, where someone has been harmed and they say there's a racial element to this, right? The reaction you'll get immediately is a sort of, but I personally in my soul am not
Mhm,
racist, right?
mhm,
And
mhm.
so I think in a sense it was quite useful to at least attempt, to at least endeavor to sort of move people's framework a bit from like the conversation isn't merely I am accusing you of being a bad person, you're saying I'm not a bad person. There are other elements to this. The example I always give is let us just say an organization requires a master's degree for all of its jobs. Let us just say that is an expensive thing to do. One group in a society has less money, therefore has less master's degrees. That could replicate an inequality
Mhm.
even if nobody in the institution, everyone in the institution was an absolute saint who never had
Right.
any bigoted bone in their body, right? And there's all
Absolutely.
sorts of examples. And so I think it was useful in getting people out of it. My I could talk a lot about guardrails. Guardrails is possibly my least favorite political metaphor. I think it misleads us in so many ways. Um, I think also there was almost just like I think with a lot of the language that came out of sort of academic social justice, intersectionality is another great example. That from Crenshaw, right, has a specific meaning about,
Yes.
and it's quite a specific metaphor. It's not just like we all have identities. It's like you're at
Right.
a crossroads and you got clipped by a car and you don't know which direction it came from.
Mhm.
Um, that when these terms got out in the world, they started meaning everything, and because they meant everything, they meant nothing. You know,
Mhm.
it just became this huge thing of like, oh, we live in a oppressive, capitalist, heteronormative, white patriarchal society, and it's like, so yeah, on the one hand, all of that's true in a sense. These are words that make sense, but it kind of, I think, left a lot of people either not doing anything or doing things that were not especially useful.
Mhm.
Like, so I don't know, I'm similar to you. I feel like there's a tension there. I think that there are good elements to this. I also feel a lot of people when they use it have just disappeared into the realms of abstraction.
Mhm. Yeah. Oh, absolutely. Absolutely. And then of course, language evolves and so concepts shift and change. But yeah, I do think that there's something particularly insidious, right,
Mm.
about how these terms have come into kind of pop culture language in the US that they're divorced from initial meaning, right? And I'm not necessarily an originalist about every single term, but I don't think that it's accidental that there's been a kind of reframing as though these terms are bad and harmful and dangerous. And I think that they become kind of substitute words for words that would be less polite to say in broader
So
society.
you're talking about like when Republicans say DEI as a
Yeah,
sort of clear
DEI or critical
stand-in
race
for
theory,
something,
right?
right?
I don't want critical race theory taught in my kindergarten. Well, it isn't and never has been, but that becomes a kind of substitute for kind of any mention of race, right? Or any
Yeah.
mention of the reality of what US history has been.
I think there's two sets of concern. There is at least two sets of
Mhm,
concerns, right, with how these terms are picked up on. And there's a few you could mention. We've done structural racism, intersectionality, DEI. Maybe something like implicit bias could also go in this. White fragility,
mhm,
which come out of different parts of academia, but come out of academia and
mhm,
have reasonably defined meanings. And you can quibble with them and debate them and whatever, but they mean things.
mhm,
And then they get into the real world, and there's two concerns. One is they kind of, to a lot of liberals, start to mean everything in sort of a benevolent way. Not benevolent, but a liberal will sort of say, oh,
mhm,
well, it's all just structural racism, and then stop talking and not do anything. And then they come to sort of mean everything to conservatives in a negative way of like you say, it's the DEI. There's
mhm.
those two stories there of how they get. One, I think, less actively malicious, the liberal
Oh
one.
yeah. Mm,
Um, and then the conservative one of using it to be really act. The liberals perhaps are using it to do nothing. The conservatives are using it to actively go after people.
mhm. I mean, King wrote about the white moderates in the letter from the Birmingham jail, and
Mm.
I think that, white liberals actually a lot of them can fit in that same bucket of kind of doing nothing or sitting on the sidelines of where they could really put their social capital on the line.
What do you make of? I just had on the show Liam Bright did a paper a while ago called White Psychodrama, which I think he's unsure if he still sort of buys, and like maybe isn't the whole story, but there's an element of truth there, right? Where on both sides, it's kind of like white people guilt but not wanting to, it's the combination of guilt and not wanting to do anything about it. So the white liberal will take a term like intersectionality, structural injustice, and go, yes, it's that, I recognize it's real, I confess my sins,
Mhm.
and then not do anything. And it's almost like they pick up these ideas and it becomes almost like a ritualized performance. Do you buy that storyline? I think there's at least something there.
I think there's some plausibility there, or I think that for many, they think that that is the doing something, right? That the
Yeah.
confession of the sin is the doing something. Like, look, I did this thing. I think that's why I'm ambivalent about things like land acknowledgments. When you go to a talk sometimes and people will say, I'm
Do
standing
people do people still do these? You'll
Oh
perhaps be.
yeah,
Oh
that
wow,
was
okay.
a talk last year, and I try. I think on one hand, I appreciate the kind of bringing awareness, and then on the other hand, I kind of think, okay, but what does this mean? Okay, so you've said this, but are we gonna talk about reparations now? Are we trying to give some land back? Like, what are we doing here other than
We're
just
acknowledging.
saying, yeah, and I think for some people, just the mere acknowledgement is the work, and I think that's why I can be a little cynical about white liberals sometimes.
Don't
I
we
think
all
we followed each other on Twitter for a while, so I
yeah.
can be very cynical about white liberals
But
sometimes.
yeah, but I mean, I am a white liberal, and I said to Liam, like the thing you're parodying there, that's me, right? Like, but at some level, don't we all recognize that and roll our eyes at it a bit? The land acknowledgement thing. Like, yeah, I want to say it's well intentioned, but part of me sort of thinks the intention is a sort of performance and a sort of like
Hmm.
you know And like, I'm not sure if I would go as it's not maybe badly intentioned, but like, if you think that that's the extent of what the demands of justice in the moment that we're in are asking of you, then yeah, I'm a little skeptical about that. Isn't everyone? I'm surprised you hear you're still really seeing this in the world. I thought to a certain extent everyone had rolled their eyes of that sort of thing into oblivion.
No, I think I saw it as recently as last year at a
Okay.
thing. Yeah.
What do you make of talking of the import of these ideas to liberals? You mentioned in one of your talks, and I liked the term, you said a lot of them get little cottage industries built around them. I think you had particularly implicit bias in mind with that. What did you mean by that?
I mean, a lot of people have made a lot of money, and a lot of people of different races. So I'm not even saying that this is a thing that white people are making
Hmm.
money on. But, a lot of people have made money, being consultants and doing trainings and giving tests around implicit bias. And again, uh, I wonder to what end. And I'm not saying that people are ill-intentioned. I'm not even saying that understanding implicit bias is a bad thing. I just find it really striking. And I'm just curious kind of what these things translate into. And one could say that about me. I mean, you and I are sitting here talking about race and talking about these things. And what is that? I mean,
Yeah, because what they
hey,
would
but
say is, yeah, we get what they would say is, yeah, we get paid for our work, don't you?
yeah, yeah. Oh, absolutely. So I'm not
You know,
suggesting that one shouldn't be paid for one's labor. Like I'm a strong advocate of being paid for one's labor. And I also, kind of wonder about um I think especially thinking about race, there always seems to be a quest for the next new thing or the next new way to talk about racism.
we go through like
But
fads, don't we?
yeah, 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 exactly. Fads, phases, without the same kind of commitment to actually do anything about racism. And maybe part of it is the bringing awareness, right? I mean, I do not poo-poo on the idea that um there are just a lot of things about the world that most of us don't know. And so it is important to have people who can bring awareness and that people should be compensated for their labor when they're doing that. I guess the old cynic in me or the middle-aged cynic in me is just worried, kind of deeply worried about the kind of improvement of quality of life and what that means. And even if the audiences that we give these talks to, I've given a few of them myself. So again, I'm not but if that kind of what's actionable that happens after that. And I think, I worry in the same way that, I kind of worry about the land acknowledgments. Okay, well, what does that mean for the quality of life for people, for actual people? Is that a commitment or is it just coming to the talk means that you did the thing?
Yeah. I mean, my view on implicit bias, and you'll know more about this one than me, so I invite your critique on this. But my impression, so here's my view. My view is something like implicit bias has to be real, surely. Just
Oh,
not on any
absolutely.
statistical, not any. I'm not giving any statistical argument, just an innate plausibility. We
Mhm.
file people into little boxes in our heads, right? And the example I always give is if you meet anyone walked into a room, walked out again, and there were 10 other people in that room, I could ask you, like, how tall they were, what were they wearing, and you'd either not know or give me wildly inaccurate answers. But if they were all of one race and I asked you what race they were, you'd know.
Mhm.
Okay, well that's something's happening in your head there that's coding that information deeply. So something like that has to be true, right?
Mhm.
My feeling is, without being like a professional scientist of this area, is like the study of it got a bit out ahead of itself in what you can confidently say about that and what you can confidently teach and train about it. So you can make people do little tests where it's like, which face do you associate negatively with, and so on. But those tests don't replicate very well, and they're not super predictive of people's behavior. And when it has been used as like the theoretical foundation for like a workplace training or something, it tends not to statistically correlate with any outcome whatsoever. It's just like another meeting people go to.
Mhm.
Now, you could say, I guess that's morally neutral. It's not harming anyone. But like on the same hand, if people have taken that as a as what they need to do, there's at the very least an opportunity cost there. Is sort of my view of it. It's not awful. It's not the worst thing in the world, but it seems like what's happened is there's very obviously it refers to something real, but your ability to study it, much less change it, it just seemed a bit over optimistic, that whole cottage industry. That's my take, but what do I know?
Mhm, mhm. Yeah, I mean, I've had students take the test, right? I mean,
Mm,
it's a cute, like it's an interesting exercise, I think.
mm,
And I also, right, so I don't think that that part is wrong, but I also think sometimes that becomes a way of evading certain kinds of responsibility, right? I'm not responsible for the things that I don't know, the attitudes that I don't know that I hold. And yeah, I think it kind of goes the way that that structural racism goes sometimes, right? That kind of making these phenomena plain and clear can sometimes for people who are well-intentioned and certain even for people who are well-intentioned and certainly for people who are ill-intentioned becomes a way to say, look, you just want me to feel guilty, or oh my gosh, this is bad and I can't be held responsible for it because the structures are too big, or I'm not even aware that I hold these attitudes, so how can you hold me responsible? So I guess those are kinds of the kind of questions that I have about these things. It's not the tools themselves. I find them interesting. I find them compelling. I've talked about them. I've written about them.
Do you think I want to maybe pull back to something you said earlier, because this is an instinct I have, and I think a few people have, that liberalism, broadly defined of its sort of more normie and more progressive components, has become like exactly like you just said, a bit a bit not believing in its own ability to change institutions and structures. That, like, on the one hand, we recognize that it's all institutional and it's big picture and everything's connected, but then that in itself can become a reason not to do anything. And there's this almost fear of power and fear of using power. Whereas if there's maybe one thing we could learn from the writing, it's this slow but aggressive, like chipping away. Like they're big on like let's take over school boards and use them for stuff and redefine what those institutions are for. And like in no time at all, they're like really affecting real world outcomes with that. And both at the micro level of like, should we reevaluate how our organization does hiring, or should we all just sit around in a circle and do a land acknowledgement? We go for the land acknowledgement. And at the macro level of like, do we try and reform American governance and think about how our system works and why it's so log jammed and, you know, do structural reform there? There's kind of been a throwing the hands up in the air. We like don't think it's within our power to not blow the institutions up, but just nudge at them in the way conservatives do. I don't know. That's like a big picture thought, but that does seem like a weakness that a lot of people have, from a lot of different perspectives, have become frustrated by.
Yeah, I mean, I also think we have to think about what political expediency has been in this country, and putting an explicit race lens on things. There have been lots of opportunities to make radical decisions, radical change for the good. And at these kind of inflection points where one could really double down on racial justice or negotiate with white racists, white liberals in mass, not like individual people, right? Have kind of have opted on the side of white racism or a kind of white solidarity. And so I think if until we take that seriously,
Mm,
we're not going to understand why these things keep happening. So, for instance, the Tilden Hayes Compromise, right, that puts Rutherford B. Hayes in the presidency,
mm,
is partly about Reconstruction. and a kind of negotiation with the South to withdraw troops and abandon the goals of Reconstruction in exchange for having Rutherford B. Hayes in the White House, right? I mean, the story is a little bit more complex, but that's it, right? I mean, this is also where the structural picture for me comes in, right? You see these moments. Very similarly with Social Security, right? Franklin Delano Roosevelt, has this big, potentially life-changing, world-changing for, everyone in the US, uh, plan to reimagine our social structures in the country. And Social Security is a part of that. But what happens in Congress? Well, the white Southerners don't like the idea of Black people getting Social Security, right? They're sharecroppers, they're maids, and even Black people who have no direct relationship with them. Just
Mhm.
the thought of Black people having access to Social Security. Um, and so what happens? Well, the white Democrats negotiate with one another and decide and declare that farm work and domestic work, the two areas of labor where Black people were largely concentrated, don't count as labor for the purposes of Social Security, right? Um, so this isn't a kind of new behavior, and I think that until we're okay with upsetting a certain form of whiteness as a category, um, and until we're okay saying, look, expediency is not worth abandoning entire populations of people. I think we're going to continue to see some of these same kinds of practices happening. I mean, I'm talking about older examples, Hayes and FDR,
I
but
can think of several off the top of my head
yeah.
immediate things in
Mhm.
today's world that seem almost in direct analog with that, though.
Right. I mean, there are aspects of the Affordable Care Act that didn't happen
Mm,
right. And so I think this is the other kind of interesting thing about talking about structural injustice, right? At the moment that when the Affordable Care Act passes, there's a Black man in the White House,
mm.
right? And yet some of the negotiations that happened to make the Affordable Care Act come to be resulted in resulted in decisions and negotiations that had a disproportionate negative impact on some communities of color.
There's a few different directions I almost want to pick up from that on. I mean, one would be it's not just liberals, it's
Oh yeah.
there's a sort of like I guess you could call it economic essentialists or like the socialisty left, who can have a view that like if we just dropped the culture war stuff and focused on economics and making sure everyone got a paycheck, like that'll unite Americans. Like if we just focus on raising the minimum wage or this or that, the other. Right, sure, agree with all that. But there's a naivety there about the fact that throughout American history, a lot of white people, when asked to choose between racism and economics, choose racism. And there's also a lot of naivety about exactly as you say, when we create these public goods, we do so in a way that we make sure to exclude certain people, or we will even actively destroy public goods we already have to prevent
Mhm.
certain people from benefiting from them. So the idea that, oh, we'll just focus on economics, as much as I agree with you about egalitarianism, seems to operate to me without much knowledge of American history.
Oh yeah, absolutely. Absolutely. And even the stuff that they're calling culture war, culture war kind of preoccupations are tied to economics and race and
Yeah.
gender and kind of social policy. I mean, it means something that, the Hyde Amendment gets attached to appropriation bills, limiting the kinds of access that poor women have to care, including a full span of reproductive health care access, right? I mean, that's not a culture. I mean, it is, I'm sure someone like Bernie Sanders might call that a culture war issue, but that's also an economic issue. I mean, it is an economic issue, right? Your ability to make whatever determinations about your health that need to be made, including full spectrum reproductive health care and healthcare access. That affects the size of family that you're going to have or don't want to have or want to try to have, how many mouths you have to feed in your household. These are economic issues. And so, when people like Bernie Sanders make those kinds of claims, I don't even know if it's a naivete. I mean, because people have kind of called him on that. And I've watched him interact and engage, and he seems to double down on the economic story. So I think that's its own kind of, at that point, that's not naivete. He's making decisions and he's making it very clear about who he is and where his commitments are.
Yeah, I mean, Bernie is like one of the people. I've written quite a bit about Bernie, and I've been yelled at by some of his supporters for what I've
Of
written.
course.
But I I'm not quite sure what's in that guy's head sometimes, because like you say, like he's persisted with some stuff, and this isn't the only example where people have
Yeah.
he's been told,
Mhm.
you know.
Very explicitly.
I I think with Bernie, he has good instincts on some stuff and very poor instincts on others. This is a bit beside the, but he's always had quite poor instincts on who to trust, I think.
Mhm.
And he has an ego. All politicians do, but I think he tends to default to the people who hero worship him the most, and that tends to be the white college kids who just want to hear about getting their student loans written off. They don't want to hear about all this other stuff. I think that's the story, but that's me sort of reading into him. But I completely agree that I mean, I wrote that New Republic article a while ago, right? Like, that part of the left has really sabotaged itself in a lot of ways when people have been telling them all along, like,
Mhm.
this is what you're doing that's alienating me.
Yeah, I mean, the Bernie Bros really don't make people want to join up with
No.
odds, some of their behaviors. But I mean, back to the kind of, well, you call it naivete, I just call it reluctance, right? To acknowledge the willingness to destroy institutions. Jonathan Metzl has that book, Dying of Whiteness, where he's going around interviewing people in parts of the country where they rejected the Affordable Care Act, interviewing white people,
Yeah.
some of whom are very clear that, oh yeah, I have end-stage renal disease, but I'm not going to take a dime of that of that money because, Obama thought about it, or because I'm worried that some black people will also get health care. And so I'm totally fine being in Kansas or Mississippi without adequate health care. Like I understand, I think sometimes we underappreciate the rational decision that a certain strain of racist white person has in terms of their commitment to racism. Right? I mean, I
Yeah.
think they're often cast as irrational or ridiculous or naive. And I think no, they're being morally consistent. And there's a part of me that appreciates moral consistency. I was trained by Kantians, right? So I respect you. If you say I am very clear that I will not get dialysis, that I as a white person in Arkansas will only have access to dialysis if the Affordable Care Act, um, if my state accepts the aspects of the Affordable Care Act that would make care available to a broader swath of people, and I have such an intense dislike of Black people or such a strong worry that Black people, or I'm from Georgia, so all Latinos are just Mexican, right? Right. There's no kind of subtlety, right? That Black people or Mexicans are going to get health care, and I don't think those people are deserving of health care, and I know that denying healthcare to them also denies healthcare to me. Like I appreciate your moral consistency around that. Like I will just die. I gotta respect, the part of me that's trained by Kantians respects that kind of moral consistency and applauds you for it. Right. And I think we gotta stop feeling bad for these people.
I couldn't agree more, and I think there has been a real refusal to believe, particularly from the tribe I would call reactionary centrists, so the sort of most right-wing slice of the Democratic coalition.
Mhm.
Um, but from a lot of just normie liberals as well, although I think normie liberals are increasingly catching up,
Yeah.
um, a refusal to believe that the core of the Trump base believes the things they are telling us they believe. I
Hmm.
think there has been a long-standing effort to put words in their mouth, more cleaned up words, more palatable words to the liberal or the centrist, that they themselves are not saying.
And
And if
they're
you
clear
talk to
about
them,
that.
they
They
will
understand
never
it. They're
say
not
this.
confused. If you ask, they can articulate a stable preference. Like they, I mean, they might not be preferences that I would endorse, but look,
And this also goes to my concern, to bring it all the way back to the beginning of our conversation, with some terms like structural injustice or implicit bias or blah 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 blah. Um, because I think what's happened there is those terms have been taken up by the types of college educated white liberals who make medium level decisions in our society, the people who are like running institutions or like, mid level powerful people, um, who have not lived in the South or have not really just gone and talked to Trump voters firsthand and, haven't personally been impacted by racism or sexism or whatever to a sort of worldview where racism is very bad. Certainly, I condemn it. But what we're looking at now is these subtle microaggressions and implicit biases and structural stuff. No one's actually a Nazi these days, or no one actually believes in segregation these days. What we're going after is the stuff you're not even aware of. Now, that stuff's real. Microaggressions, real thing. Implicit bias, real thing. But I think the abstractness and the sort of subtlety, and people say this, you hear people say it all the time. There's no real racists anymore. They used to, at least they finally stopped. Like reality's become too much.
Mhm.
But I think people were walking around with a mental model of the world where quote unquote real racists were 1% of the population. That was never true. It was never even close to being true. If you just straight ask people, do you hold racially discriminatory views? 15% are white people. Those are the ones who'll hold their hand up to it,
Mhm.
you know? And then if it depends how you ask the question, but like, are black people genetically less intelligent? That's something like 30% of white people, you know? Um, and I think, yeah, I think like some of the ways we've come to talk about it, I think have misdirected certain types of white people who, perhaps to be fair, kind of wanted to be misdirected into thinking that, like, no, people just flat believe in racial hierarchy and will privilege almost any other good over
Mhm.
it, you know?
Mhm.
Sorry.
Mhm. Yeah, I mean, so one quick thing, as someone who is from Georgia,
Yeah.
my ears always perk up when we talk about Southerners as being particularly racist, which, I think, Boston is where people were setting school buses on fire to
True.
protest
True.
school integration, in my lifetime. And I'm not a young woman anymore, but I'm not that old. And so, I want us to be clear, right? Indiana has historically one of the largest populations of the Klan. We
Mm,
have so I want us to kind of get out of because I think that's one thing that has allowed a kind of a certain population of kind of maybe educated white liberal to be able to look down on other white people, right? Like, oh, of course, that's just a kind of
agreed,
weird
and
other thing. And over here in the Northeast, we're way more enlightened.
I take the correction. And there's also, I'll add to it, there's also, I think, a view that we're talking about like working class people. And of course, there's working
Yeah.
class racists, but actually, the core of the MAGA is middle class and upper middle class people. Like, you think car dealership owner, not
Yeah.
like your backwoods guy, you know? Um,
I mean, think about January 6th. So I was still living in DC at the time. I live in St. Louis now. I was living in DC on January 6th. So, even this effort to reconstruct or rehabilitate what January 6th was is just personally infuriating to me because I lived through that. But, if you think about who was there, these people were getting off planes. They had professionally done signs. You have to be able to take off work to do that. You have to be able to, these people are chartering buses. They weren't on Greyhound. They weren't,
yeah.
packed 12 to a Dodge Charger. They were, so even the kind of outward expressions that we see should tell anybody who can see and think that these aren't just a bunch of impoverished white people without access to information or resources.
Yeah, one of the things that
Are, let's be
people
clear, like some are,
one of
but
the things that people really push down on me from is they say the MAGA is a top-down thing. This is something that comes from within the American elite and has been adopted by upper middle class people who are frustrated at certain social norms that we have and have embarked on a self-conscious project to change them. And yeah, plenty of working class people have gone along with that. But we shouldn't imagine it's this ground up upswelling of like nativism and racism coming out of nowhere. This is an intentional thing people have done. People hate that narrative, but I think it's true.
yeah, I mean, I definitely think you see people across social class
Yeah,
in participating in this movement. Absolutely.
yeah. So that was some of Toby's rants.
Yeah, no, that's fine. And I mean, you see people with the power to influence policy, right? I mean, Marjorie
Yeah,
Taylor Greene doesn't come out of nowhere, right? She's not barefoot in backwoods in a trailer park and just wanders into Congress, right? And she has resources. Yeah, so I definitely yeah, there's much more variety in social class than I think some people are willing to acknowledge.
I think there's a sort of to use a blunt term like backward hick like model of a Trump voter people have in their heads. And I'm not saying that guy's not real, but that's I would push it that you're not thinking usefully about that movement when that's your mental model.
I definitely would say that that movement is not monolithic.
Yeah.
Like any other movement, they have a variety of people with a variety of motivations. I'm deeply fascinated by Black Trump supporters. Uh,
Mm.
like, huh? Are you like how does that fit? You know, I their world, like I just find their worldview befuddling, but they exist. They're there.
That's a small that's
I
a
mean,
small
it's small.
minority
It's not a
though.
huge subset, but they exist, right?
Yeah, yeah.
I'm deeply fascinated by queer Trump voters. I'm deeply fascinated by Latino Trump vote, and they exist. And so yeah, I definitely, it's not an all white movement. It's not a poor white movement. I think we see people from all walks of who you see in the US participating in this kind of movement. And then you have people who may not explicitly be MAGA-ish, but maybe they're MAGA adjacent. Maybe they kind of quietly um support a lot of the ideals, even though maybe some things may make them uncomfortable. So yeah, I think you see a microcosm of the US. And I think that again, if the conditions weren't right in this country for that to gain traction, then you wouldn't see that.
I mean, do you think there will be an updating from the racism is essentially over people? Or let me be a bit more charitable to them, quote unquote real racism is over. It's all, it's subtle stuff now, but no one's flying a Klan flag or anything. Now that that's running the country, because I kind of don't. One of the things that sort of fascinated me is I think what you would call the sort of MLK's white liberal, what I call the actionary centrists, seem to have like functionally zero ability for admitting error. Like their worldview was really not capable of imagining this moment, and now it's here. They seem a bit adrift almost.
Yeah, I mean, so for King, it was the white moderate. I included
Oh,
some polls in there, but yeah, in Birmingham jail. I think what we see happening is what happens for a lot of people when a kind of worldview they were committed to is upended, right? A lot of us in would be adrift in that moment. And so I don't think that there's anything unique happening there. I think it'll be interesting to see how they come out on the other side of that, right? What does that mean? Right? How do you write yourself in the world once you're the whole all of the things you thought and believed in have been upended? Or do you think that this is just a temporary blip and that everything will be fine? You just keep your head down, everything will be fine. Maybe it pushes you in one direction or another. I mean,
I think a lot of people have gone from you're being hysterical and you're overreacting, and of course this is not real fascism and not really dangerous, to,
Mhm.
well, that's the new power and I might as well make my peace with it, like that.
Mhm.
And without ever a moment of recognizing and resisting it in between. I think that people are just, and I could name a lot of sort of high profile center left figures who seem to have just made that transition from you're overreacting to I might as well fold. If I'm being cynical, that's what I see.
Yeah, I mean, it is. I think for some, it's shocking with the ease that things have turned the way that they turned, right? There doesn't seem to have been a ton of pushback in the high places where it would matter.
Hmm.
And yet, I think some of us aren't that surprised. We anticipated this moment, we imagined this moment.
Some of us, I've been yowling about this from the very beginning. I think you have too,
Yeah.
but some people could not fathom it.
I mean, W.E.B. Du Bois was writing about this in like 1903. Like, why, who is surprised? Or people, I mean,
A
I
lot
know,
of
I'm
people,
just saying, you know,
you know,
anticipating these
uh,
kind of moments.
a lot of, anyway, let me ask you this as a final question, because here's something I don't know, and well, no one knows because I'm asking about the future, but I'd be interested in your informed speculation on. We've talked about how there's been a very imperfect interface from ideas about social justice originating in academia to them being picked up in the world. Both the sort of white liberals who can pick them up and then make them too abstract and just think it means they have to cry about stuff as opposed to do stuff, and then the white conservatives who pick them up and go, ah, now I have a term for everything I
Mhm.
want to vilify.
Mhm.
It seems like we're in all sorts of ways at a bit of a turning point. Let's just say the country does come through this. We can get another Democratic president in, and let's be really optimistic and say they're not completely useless.
Mhm.
What happens with that
Mhm.
relationship? Do we just revert back to that? Do we learn anything from it? Is there anything that could be done to make it better so that when academics do come up with terms that are useful and have salience, we pick them up in a better way? I don't know. That's something I wonder about.
Yeah, I don't know about the term stuff, right? I mean, language just often takes on a life of its own in
Yeah.
ways that um, people don't always predict or control or think about.
Mm,
I am curious about what the future looks like. I mean, I see a few different options. I had my students this time last year actually reading Octavia Butler's Parable of the Sower,
mm.
where that actually opens up in 2024, even though the novel was written in the 90s, and the world that she imagines. Going from 2024 through the sequel to that of Parable of the Talents, which goes to, I think, maybe 2030 or 2028, 2030, something like that. I don't know. The world she imagines is quite bleak. And so I think that's been oh my God, I hope we're not going in this direction, even though this is where it feels like we're going. And, it was really interesting to have my students read that novel, given that the protagonist, when we opened the novel in 2024, the protagonist is 14, and I had first year students reading it, so they were 17, 18, so not that much older than she is. And so I had them kind of place themselves in that and just imagine what the world could look like. That's the scary picture for me. If you ask me to predict, I could imagine having whoever in office and kind of high political position in the coming years. And there just being this inertia. I mean, that's what we see in institutions. It's not that, right? And there's a way that, we talk about, for instance, respecting the office of president or respecting the institution of Congress. And I think there is maybe something to that, and maybe there's something useful there. But I also think that, again, that veneration of the office of the presidency is sometimes used to avoid undoing terrible things, right? So even though constitutionally presidents have powers to do certain things, even though constitutionally Congress has power to do certain things, we don't see a kind of, well, until recently, we generally don't see a kind of rapid undoing of bad policy when the next group of people come into being. You know what I'm saying? Come in to operate those, to occupy those roles. And so, I am worried. I think, well, maybe things won't get dramatically worse, but I'm not optimistic that they'll get radically better. And certainly not with the rapidity that things have declined. I mean, we're not even a whole year in.
Things are definitely getting worse. I think the question is, can they rebound?
Yeah, yeah,
I
yeah.
mean, I'm not necessarily optimistic. I don't want to go full doomer and say what I don't want to say is there's nothing to be done. I don't think that's true at all.
Oh,
Like,
no, no, there's plenty to be done.
you know,
We have
and
the will
like,
to do it.
and as someone who's lived in a lot of different countries, if you look around the world, you're seeing the same two teams everywhere, like the fascists and everybody else who has to get along to beat the fascists, right? Everywhere. The anti-fascist opposition wins as often as it loses. We're 1 for 3 against Trump, which isn't brilliant, I'll grant you, but there's a win in there. Like, it's not as if we never win. We do. We shouldn't assume this is inevitable. I am not um, brimming with optimism in the US case. But as you say, like, things are complicated and contingent and stuff happens nobody could have seen coming. Like, I don't think we know people are talking about who we want to be the Democratic nominee in 28. It's like, we are so far from that. We're going to be in a very different world a year or two from now.
Hmm. Yeah.
Do you feel optimistic? It sounds like you don't.
Well, I'm just generally known for being kind of pessimistic. Anyway, I think that might be kind of my natural psychological makeup. Uh, so I want to be, I appreciate people who are. I think we need optimistic people in the world. And, even those of us who are a little bit more pessimistic, I hope that that pessimism doesn't, mean that I stop trying or stop caring or stop thinking about these things. But the world is a very challenge. There are things that are very challenging in the world now. I mean, people's very livelihoods are on the line for saying things that seem very mild and very things that might have been mainstream ideas even 5 years ago or 10 years ago
Yeah.
are being regarded as the kind of language of enemies of the state. And that's deeply concerning. That's concerning, and there are real consequences for people. So I definitely want to acknowledge that, people have things on the line. And it's the case that in order for change to happen, people have always had to have things on the line. And so I think maybe that's um, a space that many of us are going to be challenged to be intentional about. What does it mean to have things on the line? What are those things? What are we willing to risk in our kind of daily lives and our professional lives? What might that look like? And, I think that's real. And so I do want to acknowledge that as much as we've spent the hour just talking about not doing work. I mean, I think there's a difference between just the kind of this conversation makes me uncomfortable, or I'm fine with the status quo and don't want to upend the status quo too much. And the reality that for a lot of people, challenging the world that we find ourselves in now is not without very significant cost.
On that somewhat cheerful, somewhat not note. Should we pause? Thank you so much for your time today. Before you go, do you want to let listeners know anywhere they should go to follow you? Blue Sky handle, website, anything like that?
I am on Blue Sky at Prof Yolanda, ProfYolonda. That's I guess where you can find me now. I'm trying to navigate what social media looks like for me these days. But yeah,
Cool. Thank you so much for coming on the podcast.
thank you. Thank you for having me.